Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us. Going to be speaking with Dr. Tim Dorius about his experience with a 56-year-old patient named Christy who came to him for a second opinion about widespread cancer and how she was able to entirely avoid chemotherapy. Thanks for joining us, Dr. Tim. Dr. Dorius. Has anyone ever referred to you as Dr. Tim? Sorry about that.
Sometimes.
Well, welcome, Dr. Tim Dorius. Thank you so much for taking the time.
You're welcome.
Of course, someone coming to you for a second opinion on widespread cancer. Obviously, you're an oncologist. Give us a bit of your professional background briefly, and then let's talk about your experience and how it ties in with Caris Life Sciences.
Absolutely. So my background basically is that I'm a hematologist and oncologist, so I treat cancer and blood disorders, and I've been doing that for several years.
As an experienced oncologist, you see a lot of patients, not just, Chris, you said you've been doing this for several years. You see a lot of these patients that have advanced or aggressive cancers. How has precision medicine changed your approach over the years?
Fortunately, in the world of cancer, we've had a lot of developments in terms of new treatments that we're able to target cancers a little bit better than just the old chemotherapy that we used to give. Now, I don't want to minimize chemotherapy. It's still a really important part of what we do, and for probably most patients, that's the mainstay of their treatment. But sometimes we're able to target a treatment based on molecular testing and on other testing. And so that's really revolutionized the field of oncology. In the case of Christy, we were able to do that, and that has led to her having a much better outcome.
So what were your initial thoughts about Christy's case when she came to you? What was it about her case that led you to count on Caris Life Sciences?
So initially she presented with back pain, and that was what led to her getting some imaging that revealed a concerning area in the spine, in the vertebral bodies, in the bone, that was ultimately found to be cancer. And so this led to her having more imaging, including some brain imaging. And at that time, we discovered that she had an area of cancer that had spread to the brain. And the rest of her workup revealed that the cancer had started in the lungs. And so we had obtained a biopsy, it's become the standard of care to check for any particular mutations in tumors that can be targeted, and also to assess a biomarker called PD-L1 to determine whether someone would be a good candidate for immunotherapy. And so Caris has made that very easy to do. I just have to have our staff fill out a requisition, and they handle obtaining the specimen from the pathology lab where it's located, running all of the tests, and it comes back with a report, and it doesn't take very long to get it. And that allows us to see if there's any particular mutation. Sometimes these mutations allow us to treat with just a pill for some length of time. And in her case, we didn't find any of those. We did find that this PD-L1 biomarker that suggests that she would have a good response to immunotherapy was very high. 100% of the cells were expressing that biomarker.
Now, is this something that can happen quickly after an initial diagnosis, not necessarily a second opinion, but is this something that can happen relatively quickly? You said the tests don't take very long. How long is not very long?
Right. So in my experience, I usually get the results 1 to 2 weeks after I order the test. In her case, there was a suspicious area on some imaging, and that led to a biopsy. All of these things, unfortunately, take longer than we want them to take. So getting a biopsy done takes at least a few days to get that arranged. And then when the pathologist gets the tissue in his or her hands to work with, that takes probably at a minimum 2 days and maybe a little bit longer for the pathologist to say this is a lung cancer or this is a colon cancer. And once that process is done, once I have that information, that's when I send for Caris molecular profiling. And with that process, that probably takes about a week to 2, depending on how fast, really a lot of times how fast the pathology lab locally gets it to them. I think once it gets in their hands, they can run that testing fairly quickly within a few days. So usually it takes, I kind of tell patients that I expect it would take about 1 to 2 weeks to get those results back.
Well, obviously, you've got an extensive team of people dealing with all of these results to determine the best course of treatment, not just for Christy, but for any of the patients that are tested via Caris Life Sciences, yes?
That's correct.
Is this something that can take place in a central location? Is there lots of collaboration via telemedicine across the country, or is that part of the reason that it takes, not awfully long, but that couple of weeks? Is that the reason, or is this something that is done pretty much in-house? Right.
So the initial part of it happens usually at a hospital. So in our case, we have a hospital that we generally use, and so that we'll have the patient see someone who will do the biopsy. Sometimes that's an interventional radiologist. Sometimes that's a surgeon. Sometimes that's like a pulmonologist, for example, in the case of lung cancer. So that happens locally and at a local hospital, and we have multidisciplinary tumor conferences where we talk about patients as they get their diagnosis. A lot of times patients don't end up seeing me until the diagnosis has already been made. Someone has, for example, a suspicious mass in the lung. Mm-hmm. They see a pulmonologist who does a bronchoscopy, or they see an interventional radiologist that does a biopsy from what's called a percutaneous biopsy with some imaging guiding it. And so that happens already. And then I come in the picture, and when I see them, that's when I order Caris molecular testing to try to help determine the best course of treatment. And usually, sometimes it takes, I've had it turn around in a week or less. It's variable. Depends. I'm not sure all the variables that come into play, but they're pretty quick compared to some of the other labs that are out there.
How affordable is this from a patient standpoint?
One of the reasons that I use Caris is because they've made the financial assistance form that patients fill out very easy. I think it's a one-page document, and they're very generous with the financial assistance.
Let's talk about what patients and clinicians, what you'd like them to take away, the major takeaway from Christy's experience with Caris Life Sciences.
Yes. So I think the biggest takeaway is that we don't know what the best treatment is unless we look. And we now live in an era when we have that technology available to find out what the best treatment is. And we have more and more of these treatments that have come available. For example, I have another patient that I ran Caris molecular testing on his. He also had a lung cancer, and he had started another treatment. And so that we will have an option down the road to use a more targeted treatment. But actually that week, I got results back on him that showed he had a certain mutation. And as I was reading I get an update from the American Society for Clinical Oncology that tells me what new drugs have been approved. And I saw that very week, the week that I got his update saying that he had this particular mutation, there was a new drug approved for that indication, for that exact kind of patient. And so, I wouldn't have known that if I hadn't run the test. And although he's doing well on his current treatment, whenever that stops working, we'll have another option that we wouldn't know to use without that kind of testing. So I just think it's important to consider that testing. As for Christy, she has done very well. We saw that she had this particular biomarker, PD-L1, that was 100% positive. Mm-hmm. And in her case, she was able to take immunotherapy, and she's been on it for now. Her diagnosis was about 2 years ago and has done very well and is very active in what would have previously been a very tough disease to treat.
Where can our listeners go online and get some more information about Caris Life Sciences?
So I think they could actually go to a website called carislifesciences.com, and Caris is spelled C-A-R-I-S. So that has all the information about the testing that they offer.
Tim, I appreciate you joining us here on the program. Hoping that you'll come back and talk with us again about what it is that you do and some of your patients' successes with Caris Life Sciences. Appreciate you joining us this morning.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Tim Dorius. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.